Welcome back. Thank you for staying with us. St. Lucia's travel bubble has been revised and 2 countries have been removed. Meanwhile, the Minister for Tourism, Dominic Fede, has sought to highlight the potential benefits of St. Lucia's position as a destination of choice in the bubblecation campaign. This comes in response to concerns that the government may be biting off more than it can chew by allowing a continued increase of tourist arrivals. More in this report.
The latest campaign from destination marketing brand Caribcation aims to funnel interested travelers within the travel bubble to pursue vacation packages in St. Lucia. This has been an area of public concern, with many questioning the ability of local authorities to manage large groups of visitors while maintaining COVID-19 protocols. Marketing Manager for Caribbean and Events at the St. Lucia Tourism Authority, Christopher Gustave, has provided an update on which islands are eligible for bubblecation.
Bahamas was recently taken out of the bubble because of the increasing cases and the fact that the country is now on a 14-day lockdown. We are going to continuously adjust our protocols based on the situation on the ground, working with the health department to ensure a safe bubble experience.
Minister for Tourism Dominic Fede, who previously disclosed that the island currently hosts 1,700 tourists, expressed confidence in St. Lucia's COVID-19 protocols. He went on to attest to the benefits of the bubblecation campaign.
What it does, it eases travel among the safe countries, but there is still need for the flights, the connectivity. So while you've opened your borders to countries that are safe, like the Caribbean. And people have been saying for a long time, why didn't you open to the Caribbean first? We were open to everyone. I want to use this opportunity to debunk the ongoing suggestion or misnomer to suggest that we had only opened to the American market. That is absolutely false. When we opened our borders, we opened our borders to all countries.
A recent revision of travel bubble protocols has made it necessary for all travelers to obtain a PCR negative test no more than 7 days prior to arrival in St. Lucia. All visitors are subject to mandatory screening on arrival and must comply with all on-island protocols, including testing, quarantine, and state-operated isolation where necessary. Bubblecation visitors with a travel history of any island within the travel bubble in the last 21 days will be exempt from quarantine. Jacques Wooding, Hot 7 News.
The director of the Pan American Health Organization, PAHO, has voiced concern over disruptions in health services throughout the Caribbean as health professionals are redirected to care for COVID-19 patients and individuals in quarantine. She further notes that a wider issue is developing as people hesitate to seek routine care for chronic illnesses due to fears of infection of COVID-19.
There are concerns that the continued effects of the COVID-19 pandemic will severely affect the operations of regional healthcare services. According to Director of the Pan American Health Organization, Carissa Etienne, some aspects of the health sector have already been disrupted. Etienne made these remarks during PAHO's virtual media conference, in which she said that as countries in the Americas continue to grapple with the virus, non-COVID-19 related programs such as public vaccination, clinics for pregnancy care, HIV, and tuberculosis have also been affected by a shortage in staff.
Within every country in our region, health workers are being redirected to care for the influx of COVID-19 patients. Many of them have gotten sick themselves as they tend to those in need. And without doctors and nurses available to offer other essential services at the first level of care, such as pregnancy-related care and management of chronic conditions like diabetes or infectious diseases, such as HIV, TB, and malaria, these services are severely disrupted, or worse yet, halted entirely.
She says the situation became more concerning when PAHO received reports of people boycotting healthcare in general due to the fears of contracting COVID-19 at public health facilities.
Patients who are sick or who think they might be sick are hesitant to seek care for fear of COVID-19 infection or because transportation disruptions and lockdowns have made it harder to reach their local clinics. Some may even assume that care is not available and postpone the help they need, often worsening their health situation.
ATN suggested that countries adapt to the pandemic by making changes in how healthcare services reach the public through home visits, community outreach programs, and telemedicine. She urged governments to strike a careful balance for public health between COVID-19 treatment and general healthcare services.
COVID-19 will not go away anytime soon. This pandemic is a reality that we need to adjust to by continuing to actively implement measures to control the virus and by using data about the virus spread and the state of our health systems to calibrate our actions.
The director urged healthcare systems to adopt an integrated approach to treatment by incorporating testing and contact tracing, together with immunization and mental health support. Jacques Wooding, Hot 7 News.
According to the General Secretary of the Civil Service Association, Claude Paul, the CSA executive election, which was previously slated for April 2020, will remain on hold until the end of the state of emergency scheduled for September. Paul says this decision was made in the best interest of the health and safety of the CSA membership.
The Civil Service Association was previously slated to host its executive elections on April 29, 2020. However, due to the circumstances and health concerns presented by the COVID-19 pandemic, the decision was made to issue an extended postponement of the election until further notice. General Secretary for the Civil Service Association, Claude Paul, explains that the execution of the election will depend heavily on St. Lucia's position coming out of the state of emergency.
CSA General Council took a decision way back in April to activate the process at the end of the state of emergency. Now, the state of emergency was shifted to September 30th. So at that point in time, a decision is that you take 2 weeks for completion of the registration process, a month thereafter for the candidates to make themselves known to the membership and the elections.
He says candidate registration has been active, with many positions already at full capacity. The positions of Assistant Secretary, Assistant Treasurer, and Trustee are still open, and a deadline date for applications to these positions has been extended by an additional 2 weeks.
Well, I think most of the positions had been filled, with the exception of 1 or 2. At the time, the country was closed, basically. And so, just those 2, I think 2 positions, the one being Trustee, and I suspect the other one was the assistant, had not been sufficiently populated with candidates. And so, for those 2 positions, there's a 2 weeks extension. And so we expect elections based on that to be sometime in November, I suspect.
Paul reiterates the CSA's position on the COVID-19 pandemic, noting that it is an issue which the association approaches with all seriousness. He says though current projections would land the election in mid-November, the situation remains fluid. Jacques Wooding, Hot 7 News.
The director of the National Emergency Management Organization, NEMO, Doreen Gustav, says the list of emergency shelters for St. Lucia has been updated and should be available to all members of the public by Monday. She says given the COVID-19 pandemic, the organization was given the task of finding new shelters in a bid to remain compliant with all health and safety protocols, a task which she says was very trying. Genevieve Gonzaga has more.
Coupled with the ongoing COVID-19 pandemic, the 2020 hurricane season is expected to produce at least 13 to 19 named storms. The question has been raised as to whether emergency shelters around St. Lucia will be able to accommodate its regular amount of people while complying with COVID-19 health and safety protocol. The director of the National Emergency Management Organization, NEMO, Doreen Gustav, says the list of designated shelters have been updated. Thus, one aspect of hurricane preparedness is complete and will be made available to the public by Monday.
We have completed the assessment of shelters. At present, we have 220 shelters. This week we are to adjust it by at least 7 more, I think. 220 shelters, because what we have been doing is trying to identify additional shelters that in the event there is an emergency, persons are able to go to the shelters and maintain social distancing. Protocols have been put in place. It has been also approved by the CMO, awaiting Cabinet's approval. These protocols are extensive.
She explained that the hunt to find more shelters in the various communities was challenging, but various stakeholders assisted, and in the end, the search was successful.
Very difficult. We had the Ministry of Infrastructure Works Department. They are the lead on certifying the shelters. However, we brought on board all of the necessary entities, the various agencies, like we had our shelter managers on board, we had our district disaster committees, fire department and environmental health department had to do their checks also. And so in areas where there were just one church, we had to try and find maybe privately owned, let's say, a dance hall, mothers and fathers hall. And so they had to assess these places to ensure that they are able to withstand a storm, so to speak.
Gustav says the shelters now have to ensure that not only can the 6 feet distance be kept, but a quarantine area is needed as well.
At the shelters, we have to ensure that there is an isolation room for each shelter. We have to have our medical team on board. There must be signage, clear signage at every shelter to ensure that persons are aware of what is expected of them. There will be checks when persons come in to ensure that there is no fever. If there anything of sort are identified, fever, coughing, sore throat, things of sorts, we will put these persons in the isolation room, awaiting transfer to the hospital where they will get the medical attention.
The updated list of shelters will be published in the National Gazette and then subsequently all NEMO social media platforms and will be placed in each community. Reporting for Hot 7 News, I am Genevieve Gonzague.
You're watching the Hot 7 TV Nightly News. There's more news coming up after the break.